to think that this process of health care is about them. Did I get appropriately consulted? Did I get invited to enough meetings? Did I get a headline? What do my consultants think I should say about all of this? What's the right words to use? Here, let's hire people to tell us how to describe all of this. Well, let me ask all of my colleagues something. Is anybody here worried that they're going to lose their health care insurance over the August break? Is anybody here unable to afford the care that they think they may need for them or their families? Has any member of this body or the other body been staying up late at night recently with a sick child for whom they can't afford to get treatment? Has anyone I serve with here spent the last 3 hours bounced from voicemail to voicemail to voicemail to voicemail as you try to find out why the insurance company you pay thousands of dollars to every month suddenly refuses to pay for your spouse's cancer treatments? Is any member of Congress, as they get through the August break, back in their states and districts or on vacation someplace, are they stuck at a job that pays too little because they have a pre-existing condition and won't be able to get coverage anywhere else they might get hired? Has anybody here been driven into bankruptcy or lost a home, as 10,000 people will today? Their homes will get a notice on foreclosure because of medical bills your insurance company wouldn't cover. Has anyone in this chamber or anyone in the other chamber, a small business owner, has had to choose between cutting coverage or putting your employees you care about, who've been loyal to you and help you build your products every day, talk about laying them off or not providing the health care coverage you had? I suspect no, Mr. President. Well, then why are so many in Washington acting as if this were about us, about whether or not you're a blue dog or red dog, or whether or not you're a Democrat or Republican or conservative, a moderate, a liberal, as if somehow that was the most important issue in the country, rather than the people out there who send us here to grapple with an issue they wrestle with every single hour of every day. And we're in danger, in my view, of losing this once again, falling, as has every other Congress and every other administration for 70 years, because this was always about us and not about the people who sent us here, asking us to try and come up with some answers that would relieve them of the fear and the frustration that confronts them every day and grows as a result of our inability or unwillingness to come up with national health care reform. The same isn't true, of course, for our American people, as I've mentioned, and that's why it isn't about us. It's about the 47 million people who are uninsured, the 87 million who are underinsured in our country, the 14,000 a day I just talked about who lose their insurance, and the millions who will lose it if we don't act. It's about the people who pay our salaries and our great health insurance companies as well, the people who sent us here to fight on their behalf. And when we pretend that this is about us, when we treat health care reform like it's some kind of a game, a political contest, who's going to face their Waterloo, who's going to lose, who can go in for the kill now and defeat someone, put them into trouble, maybe they'll lose an election over this. If that becomes the game, as it appears to be in the minds of some, then you wonder why the American people get so angry and so frustrated when they watch us talk about ourselves as if we were the only people on the face of this planet. So, Mr. President, you better believe that if any of us had to go through some of the things that I suspect every one of us have heard from our constituents, every one of us do. There's nothing unique about what I'm about to say. You can go to any state in our country at almost any hour, and you can repeat some of these stories that I'll share with you briefly this morning, as I've heard from my own state in Connecticut. There wouldn't be anybody calling for more delays if you listen to these people more carefully. Sometimes we get involved in these numbers, and we mention 14,000 and 87 million and 47 million, and it sort of glazes over the eyes in a way. They seem to become almost, is there anybody involved in these numbers, any stories involved in here? Well, this legislation would be done by now, I think, if we paid more attention to some of these individual stories. In 2005, Mr. President, a young woman in Connecticut named Maria was diagnosed with non-Hodgkin's lymphoma. And when she asked her insurance company to cover her treatments, the insurance company found out that Maria had once gone to a doctor for what she thought was a pinched nerve. Even though no tests had been done for cancer, the insurance company decided that the doctor visit meant Maria's condition was a pre-existing condition, denied her claim. Maria died from that illness. A young man in Connecticut named Frank disclosed on his insurance application that he sometimes got headaches. Several months after he got his policy, he went in for a routine eye exam. And his eye doctor saw something he didn't like, sent Frank to a neurologist who told him that he had multiple sclerosis. Frank's insurance company decided that Frank should have known that his occasional headaches were a sign of MS, and they took away his coverage retroactively. Frank's doctor wrote them a letter saying there was no way anyone could have possibly suspected that an ordinary headache was related to multiple sclerosis. The insurance company left Frank out to dry. He was stuck with a $30,000 medical bill that he simply couldn't afford. Frank's condition got worse, left his job, and went on public assistance. People like Kevin Galvin. I've held a series of town hall meetings in my state, Mr. President, 4 or 5 of them over the last number of months, just to invite people to come and share their concerns and stories about health care. The first one I held, by the way, to give you an idea, and I suspect this has been true of others who've done this, I held outside of Hartford, Connecticut. It's 8:30 in the morning on a Monday morning. Now, my first reaction to my staff was, what in the world are we having a town hall meeting at 8:30 on a Monday morning? No one could possibly be there. 750 people showed up at that small community college on the banks of the Connecticut River in Hartford to come out and be heard and listen and talk about what was going on in their lives. But Kevin has shown up at a lot of my hearings to talk about these issues. And so I put up his picture here today. I've met Kevin, as I say, at a number of these gatherings that we've held around the state to listen to people's concerns. Kevin owns a small business, Mr. President, in Connecticut, a maintenance company. He employs 7 people in that little firm of his, some older, some younger, and can't afford to insure them. His younger employees use their emergency room at their homes, communities as their doctor, regular doctor. If one of them has a child with an infection, they'll spend all day, as Kevin has told me, in the ER, waiting for them to get basic treatment, costing the employees a day's work, and Kevin a day's work, obviously, from that employee. By the way, just to remind people, we can't afford have any additional costs. Think of this. If you have an insurance policy, on average, your family is paying $1,100 a year on your insurance policy to cover people like Kevin's employees, the uninsured. That's how much the average cost is per family. That's a tax on every insurance policy to pick up the cost of Kevin's employees, the one who shows up in that emergency room. You don't get free medical care there. They're charging for it. How do they charge for it? The premium costs go up for everyone else. On average, $1,100 per family in the United States. Kevin has 3 employees in their 20s and 30s who never have had a physical or a dental, a cleaning by a hygienist. One of them, age 28, with 2 children to support, was out of work for 12 weeks and nearly died due to a staph infection he got from an untreated cavity. Kevin stepped in, the owner of that little company with 7 employees, paid that man's salary during those weeks and also all of his medical bills. That's the kind of person this individual is, even though he doesn't have the kind of business that allows him to pick up that insurance tab for all of his employees. But Kevin stepped in to make a difference in that family, and I know many do that. He's not alone in that regard. But it's awfully difficult to make a business work when you've got to turn around and pick up the lost wages, or pick up the wages, rather, for someone who's not there at work, not to mention their medical bills and expenses. Another one of Kevin's employees recently left for a job with health insurance, even though the new job gives him far few hours and pays him 1/3 less than he got from Kevin. Another employee has been with Kevin, the company, for 24 years, relying on his wife's, the employee's wife's, job for their health insurance. She got laid off recently, Mr. President. They'll be able to get COBRA insurance for a short period of time. But Kevin's employee has a pre-existing condition, and his wife is a breast cancer survivor. Now, you tell me whether or not you think they're going to get health care coverage under present circumstances with a pre-existing condition of being a breast cancer survivor in that situation. And Kevin's employee has his own pre-existing condition. You don't need to be a PhD in health care issues to know what's going to happen. Under the present circumstance, if we do nothing around here, that guy and his wife get nothing. And they'll be looking for any kind of help they can get. They, like millions of our fellow citizens, Mr. President, are looking to us, those of us gathered here. I don't know what Kevin's politics are. I don't know whether he's a D or an R, liberal, a conservative, moderate, a dog, blue dog, whatever he else may be. I don't think he thinks that way. I think all he thinks about is he's trying to take care of his employees and his family. I don't think that little Maria that I talked about with non-Hodgkin's lymphoma, that her family wondered what politics they were, whether or not they get help. And I don't think any American does. Is once again, we're sitting around here deciding we're going to drift off for a few more weeks or months because we can't seem to come together, or we're going to sit there and attack each other politically. And here this country and this problem grows by the hour. And because all of us don't have to worry about that. And I say it respectfully. But nonetheless, it does impact the decision-making process. When you don't have an ounce of concern about your insurance and your ability to take care of yourself or your family, you lose some of that motivation. It seems to me that we ought to be having here when it comes to addressing these issues. So, Mr. President, I'm going to be talking about this every day that we're in session, and every day until we get to the point of coming together and addressing this issue.